Howdy and welcome to another video edition of Remedyland. Today I want to talk to you about dental deep cleaning. Deep dental cleaning helps dentists to completely clean your gums and tooth roots in case you are afflicted by periodontal problems. Dental deep cleaning, also known as scaling and root planing, is probably the most typical and traditional type of remedy for periodontal disease. The therapy improves the healthiness of your gums, stopping tooth and also bone damage. In case tooth plaque and tartar remain on the tooth, it offers the appropriate environment for harmful bacteria to flourish. The harmful bacteria inflame the gums, therefore they bleed on a regular basis. You probably will observe this in case you are brushing the teeth, or perhaps consuming food, and occasionally the gums might bleed a little. This is often the initial phase of periodontal illness known as gingivitis. In case you have gingivitis, the dental surgeon or perhaps hygienist are going to thoroughly clean your teeth by scaling and also polish all of them. They might additionally suggest an antibacterial mouthwash which contains chlorhexidine, and also present to you the way to scrub, brush and floss your teeth appropriately. The majority of older people have certain level of periodontal disease. To prevent periodontal disease from growing, your dental surgeon could recommend periodontal treatment, or dental deep cleaning. This removes the harmful bacteria in the pocket and also delivers the required environment for curing to happen. There can be certain misunderstanding regarding the distinction between scaling and root planing. Scaling is essentially the method of getting rid of tooth tartar from the surface areas of the tooth. Root planing is the means of smoothing the tooth root surface areas and eliminating every contaminated tooth element. For those who have periodontal disease or gum pocketing, the periodontal pockets around the tooth will get deepened, therefore permitting tartar accumulation to develop under the gum line. The two procedures have tendency to blur as a group because throughout the cleaning procedure, the dental care personnel scales away tartar and also conducts every required root planing simultaneously. Any kind of roughness could be planed away to produce a shiny silky surface area. Determined by the deepness of the pocket and also harshness of the tooth root surface area abnormality, the dental surgeon may decide to create the region numb to ensure that the procedure is relaxing and suitable for you. Don't think twice to talk to your dental surgeon or perhaps hygienist how to better control any kind of pain. A deep dental cleaning is a pretty standard treatment which is not often hurtful. People who fear dentists or perhaps people who have noticeable tooth tenderness could sense additional pain compared to the typical people. Furthermore, individuals that have not experienced their teeth deep cleaned in a very long time can be prepared to feel an extended dental deep cleaning, as well as some additional removing or scraping to reduce plaque from teeth. For many individuals, nevertheless, a dental deep cleaning is a bit more annoying than hurtful. Instead of injectable anesthetics, Orexix could be a choice to try out with dental deep cleaning. It is actually a unique non-injection equipment that provides external anesthetic liquid softly into the periodontal pockets, therefore staying away from numbing of the lip area and or tongue as can happen with local anesthetics. Orexix mainly numbs the periodontal pocket alone, so it is probably not be useful in removing fillings in the teeth. Many clinics might not have this machine, therefore it's wise to confer with your dental care clinic. Occasionally, in case the periodontal pockets are not very deep, there could be little to no pain throughout the treatment, possibly without numbing. The main discomfort might be the scraping sensation along the teeth because the region is scrubbed and smoothened. A tooth root planed root surface area free from tartar carries a greater possibility of enabling the periodontal tissues to recover and also reattach to it. Because of this, certain deep periodontal pockets could be decreased after a dental deep cleaning. Usually with more serious pockets as well as substantial abrasive root walls, the deep scaling and root planing treatment could be split up into quadrants of job per treatment. For instance, the top right side of the oral cavity could be undertaken a day, therefore the 3 additional regions undertaken at individual visits. or perhaps 50% the oral cavity, right or left, top or bottom, could be dental deep cleaned for treatment. Additionally, this enables just a section of the oral cavity getting frozen during a time and also results in much more tolerable, quicker visits. The dental surgeon might use antibiotic gel within the periodontal pocket for a second time to take away every terrible germs, or perhaps might rinse the pocket with numerous remedies, for example glycoside. The majority of dental deep cleaning require between half an hour and an hour. In case the dental deep cleaning belongs to an annual examination, the dental surgeon may additionally undertake x-rays to look for cavities. A dental hygienist generally carries out the majority of the dental deep cleaning. The dental surgeon are going to typically take a final peek, or even carry out certain hard tooth plaque elimination when it comes to the finish of the dental deep cleaning, and furthermore check the gums for periodontal disease. Any individual with a coronary heart problem or perhaps who have gone through coronary heart surgical treatment must let the dental surgeon know before the day of the dental deep cleaning. Individuals with coronary disease or perhaps coronary heart defects face a substantial danger for getting a condition known as bacterial endocarditis, which could significantly impact the coronary heart. The only therapy required before a dental deep cleaning, except if differently directed, is a dosage of antibiotics an hour or so before the dental deep cleaning. In case a dental surgeon fails to know the appropriate quantity, in that case the patient must get in touch with his or her doctor. Generally dentists knows the quantity, however if uncertain, it's furthermore possible for you to discover advice from the American Heart Association, which lists all of the suggestions for bacterial endocarditis protection are made so worried by dentists them to might request nitrous oxide still. Alternately, an individual may require a tranquilizer around an hour or so before the treatment to reduce panic. In situations of significant panic, certain dentists utilize an approach known as sleeping dentistry, in which an individual could be medicated and basically sleeping throughout a therapy. Pain could vary after tooth replaning, however you can count on it to become more painful later on because it's generally in a much deeper area under the gums. The teeth on their own could possibly be a little more tender to high or low temperature, and also light bleeding could take place for some time. Brushing as well as flossing could be postponed or perhaps carried out more delicately to stay away from irritating any kind of bruised or sensitive periodontal regions. Your dental surgeon or hygienist could suggest salt water or perhaps glycoside and rinse. I hope you've enjoyed this video edition. We'll see you again on another video edition of Remedy Land. Take care.